All right. Well, welcome back to the podcast. I'm your host, Ben Iames, here exploring the depths of healthcare. Got a great guest joining us today. Monica, why don't you introduce yourself? Tell us a little bit about you and what you do. And yeah.
Yeah. Well, thanks for having me, Ben. I appreciate it. So
Yeah.
my name is Monica McKitterick. I am a family nurse practitioner for the last 17 years, which makes me feel really old. But I have worked in all the worlds of healthcare. But most recently, I decided to do it myself and opened a direct primary care office a little over 6 years ago. And so I really did that because I was done treating my patients like cattle and wanted to actually do real healthcare instead of sick care. And it's been pretty life changing, to be honest. Has had lots of ups and downs, but has been rather successful. And so here we are, doing what we love.
6 years later, still working.
Yeah, I will say though, I don't do patient care anymore. So I gave up patient care a year and a half ago, and I am just the CEO now. And so my work is very different in that I'm not doing medical stuff all day, but I'm still doing the same thing, and that's building relationships with people and educating people all day, every day. So work is a little different, but also my practice runs without me, which is amazing. So I can leave for 2-3 weeks at a time, go on vacation and come back and this place is still up and running. So
It's
that's
still
great.
there. The fire hasn't burned it down.
Yeah. Yeah. I have great people in the right place.
What exactly, I mean, obviously you've been practicing for a long time, seen a lot of patients over your career. What inspired you to be more proactive in the treatment of patients rather than reactive in the normal primary care model?
Yeah. So for the first 10 years of my career, I worked in the insurance-based system from orthopedics, urgent cares, family practice. And I've always loved primary care because I
Yeah.
was taught to take care of a whole person.
Right.
But it is exhausting. And I was 35. I'd been an NP for 10 years and I was like, I still have another 20 years to go and I don't know that I can do it. So
Right.
we were actually relocating to Texas and I got a Facebook ad that said primary care physician takes home $400,000 a year and is home in time for dinner. And that clickbait worked like a charm on me. So I sure did
Noted.
click on that.
Ads that
And
work.
it was like, that can't be true. Like, there's no way. I want to know what this is about.
Sure.
And so it was all about this model of healthcare called direct primary care, which is
Hmm.
basically membership based healthcare for those that may not know, where it's like Netflix for your doctor. And so people pay a monthly fee, but they can come in as many times as they want and you get to build real relationships. And, you take care of 500 patients instead of 3,000. And that seemed really fun to me. And so I looked into it, went to my husband, who had an MBA, and said, I'm going to open a practice where I can see less patients, take better care of them, have more control of my time, and make the same amount of money. And Ben, he straight up laughed in my face. And he was like, there's no way. Like, that's not real life. You might be able
Pipe
to have like
dream.
3 of those, right?
Right.
So did a bunch of research, jumped in with 2 feet and moved to a new state. So I didn't even have a patient following at the time.
Wow.
Opened my practice and now it's grown to 3 locations and 2,200 patients. So yeah.
Wow. Wow. Just
Yeah.
in like 5 or 6 years.
Yeah. And all because I wanted to do what I went to school to do, right? We go to school for 9 years to take care of people. And then you get out into the real world and realize you spend your entire day charting for insurance companies and doing what an insurance company thinks is best for your patient, not what you think is best. And that was just not okay for me. I was done like cutting my patients off and figuring out what prescription I could write for them to get them out of my office and move on to the next person because I had to see 30 patients a day because I was working for some guy in the C-suite who has never seen a patient a day in their life, but wants to tell me how to do my job. And yeah, I just couldn't do it anymore. So I was like, well, why don't I just give myself a job? And so I had zero intention of making this into a business. My sole
Was
feat
seeing
was
patients,
to
caring about them.
and right. And to do what I loved and to give myself a job.
Yeah.
And so I did. And it's just kind of morphed into a business. So
You
yeah.
found your why. I think that's what I'm hearing, and that's what the listeners will hear. You found the why of, I actually care about people.
Yeah. Turns out. And that's what I'm going to tell you 90% of healthcare providers, that's why they go into healthcare. It's because
Yeah.
they like to take care of people.
Yeah.
But unfortunately, our system does not allow for that.
It takes that dream and it breaks it into little crumbly pieces, usually.
Absolutely. Yeah,
Now,
absolutely.
tell me more about the discovery of, okay, so like you said, you found the clickbait, it got you, hooked you, you did a little bit of research. How did you kind of just jump in? I mean, obviously that's terrifying usually when you start from
Yeah.
scratch, have no guidance, new place and everything. Tell us a little
Yeah.
bit more about that.
Turns out I didn't even know what the word entrepreneur meant at that point. So when I say I did a little bit of research, I really did a lot of research.
Okay.
I watched a ton of YouTube videos, podcasts. I went to a conference, all
Good.
learning about this model
Right.
to learn from others who had done it before. And at the time, direct primary care was only about 10 years old. And so
Hmm.
there were maybe 1,000 offices across the entire country. And most
Mm,
of them were run by physicians.
right.
And I will tell you, the first conference I went to was mainly physicians. And I have never been so belittled for my credentials in my life. Like, I
No,
literally had to turn my name tag around because I was like, I just can't let people know who I am, like that I'm a nurse practitioner and not a physician, because they were so like gung ho and like, you don't belong here,
they were so
which kind of
snobby,
just,
huh?
right? It just kind of fueled my fire to be like, oh, you want to play? Okay, cool.
Yeah.
Right. So now I
Yeah.
have the largest DPC in all of the Austin area, and I'm the only one that is 100% nurse practitioner run. So whatever, dudes, you do your thing.
Take that.
But yeah, it was a lot of learning. Like, how do you get a website? How do you establish an LLC? How do you get a bank account? There's this thing called an operating agreement. Who knew you had to have that to get a bank account? And by the way, ChatGPT was not a thing then. So I couldn't just ask, like, write me an operating agreement. Now it would be much easier. And even though my husband had an MBA, he was never taught how to like stand up a business, right? That's mainly like consulting and making businesses best, right?
Right.
So it was a gigantic learning curve because Nurse Practitioner 101 did not have a single thing about how to run a business.
Imagine
So it
that.
was, yeah, it was a lot of learning curve.
Yeah. Yeah. So, um, where were the moments where you were like, "Uh-oh, I shouldn't have done this"? I mean, there's probably 101 of those.
Yeah. I'll say the
Yeah.
scariest day was when I signed my lease, because you have to
Mm.
personally guarantee that for 3 years. Like, you have to pay for that space whether you use it or not. And
Mhm.
it was like, well, I'm gonna hope I can do this.
Yeah.
But there were a lot of like, people didn't get it, people don't understand. And then learning marketing was just like, oof, that was a whole nother world, because my biggest struggle is people don't know what direct primary care is, right? They know what primary care is, but then they're like, oh, you take my Blue Cross? I'm like, no, I don't. And they're like, oh, okay, then see ya. Bye. And I'm like, wait. No, I can actually save you a lot of money and
But wait,
time.
there's
And
more.
yeah, so it's so much education that
Yeah.
I didn't realize. I had to become very comfortable on camera. I've always been pretty comfortable public speaking, but really had to dive into that. I mean, I was doing presentations at the chamber and meeting with business owners constantly, and just telling the world what I do. Yeah, just go to my YouTube channel and look at the first video I posted back in April of 2019. It's horrifically terrible. Like, I am so uncomfortable. It's awful. But
I'm
now
really
it's
excited
like,
for after our listeners to hear about this to go check
oh
it
yeah,
out.
absolutely. It is. I actually made my entire family leave my house just for me to record it because I didn't want them to listen to me. It was a whole thing. Yeah. Hmm. Yeah,
Yeah, but that's how you learn, right?
absolutely.
I mean, you learn from
100%.
experience, you learn from trying something, and you know, I think physicians, PAs, NPs, we all have skills. A lot of, I mean, we have tons of hard skills, right? The things that we've
Mhm.
learned in our training. We all actually have a lot of soft skills and can kind of morph those into business development as well. We just have never had to expand our horizons in that way unless challenged with it.
Absolutely. I will tell you, healthcare providers are some of the best salespeople in the world,
Yeah.
because that's all you do all day long is
Yep.
sales. You just don't realize it,
Yep.
because every time you see a patient who needs to start a pressure medication or needs to stop eating sugar, you are selling them on that, right?
Yeah.
It's all about risk mitigation and risk and benefit. And that's what you sell all day long. So actually, healthcare providers are amazing salespeople. They just
They
don't
just
know
don't
it.
know it. They just don't know it. Yeah, I think about even when I go to work and I'm saying, "Hey, we did all these tests. I get your complaint, but it doesn't seem to be an emergency. I think it's safe to go home." And they say, "Well, are you sure?" And I'm like, "Yes, I'm sure. Here's why." And they're like, "Okay, I feel better. Thank you."
Yeah. Absolutely. Well, and then
That's
you
all
get
that it
the ones
takes.
who don't want to believe you, right? And then you have to really sell yourself to be like, no, I've seen this a lot. Like, this is what I do.
Yep.
This is why I'm here. Right. And so it is. And some people are just not going to believe you. They're not going
Yeah.
to fall for your sales. And that's
Yep.
okay, which is something I've really had to learn is that it's
Sure.
okay for people not to think I have the best service on the planet. Right.
Mm.
I think it's amazing. And I don't
Mm-hmm.
understand why anybody would not want a direct primary care provider.
Mm-hmm.
But there's going to be people who don't. And that's okay. And that's taken me
Right.
a lot of time to understand and accept.
Because you want to sell everybody at 100% margins, kind of
Yeah.
being able
Well,
to
and
get everything. Yeah.
I just want everyone in the world to have amazing healthcare. And
Totally.
so when they don't get it, when they're like, why would I pay you? Like, I have insurance. I'm like, when was the last time your insurance company gave two craps about you? Because they
Right.
don't. Like, there's a time and a place for them. But yeah, it's getting through the barriers. But
Totally.
yeah, it's been a learning curve.
What are some of the things, I'm shifting a little bit in our questioning, but what are some of the things about your DPC model that you offer your patients other than obviously it's a membership every month. You can come in anytime and kind of talk about things. But what
Mhm.
do you have any extras or add-ons when it comes to like labs, imaging, outsourcing, kind of
Yeah.
specialists? Like what
Absolutely.
talk a little bit
So
more.
we have a contract with a local lab that gets our patients about a 90% discount on lab tests. So
Yeah,
like
imagine that.
if if you want your testosterone checked, it's $6. You want an
Okay.
insulin level done because it's incredibly important to get an insulin level because it's way better than a hemoglobin A1C, it's $5. But if you want that hemoglobin A1C, it's $2.25. And so it's all about price transparency, ordering what the provider and the patient want
Hmm.
and going with it. Like there's a CA-125 test. It's an ovarian cancer test. Average cost through an insurance company is $500, and it's not covered by any insurance company across the entire country. You can get that same test at my office for $13. Do you know how many
No.
lives you could save if we just tested every female for ovarian cancer?
Just throw
Like
a
it's
screening
one
on
of
for 13 bucks.
right? But instead, because it's not the FDA, they say you need it. Like, go get your pap smear every 3 to 5 years. But God forbid we actually do a test to check for a cancer that will kill you before you even know you have it.
Right.
It's mind blowing to me.
Wow.
And so I think there's lots of things we do, right? So we also have a consulting service that we use free of charge for our patients. So if I see you so primary care providers, we know minimal amounts about a lot of things.
Everything.
And then there's the specialist that knows everything about a few things. And so when it comes to certain things, it's like, well, I'm not sure what to do with
Sure.
that. Right.
Yeah.
And so we have a consulting service where we can consult up to 120 different specialists and subspecialists free of charge for our patients. So we pay a fee for it, but I can like type up a synopsis and send it to rheumatology and cardiology and all the ologies and be like, am I on the right track or I am lost? What do I do? Right.
Hmm.
And it not only saves our patients a lot of time and energy, but also stress. It's really hard when it's like, well, this lab came back funny, but I don't know what to do with it. You might be dying. Well, I don't know. Right.
Yeah. Yeah.
But I'll get you an answer in 24 hours instead of like, well, I think you need to see a rheumatologist and you can see them in 8 weeks. And that's going to cost you $450, right?
8 weeks would be short too. You can
I
say,
know.
let's say like, hey, you need to go see a neurologist. Good luck in 9 months.
Ooh, yeah.
You know?
Neurology is so hard. Yeah.
Right.
So
How did
it's,
you get this consulting agreement? This is the first time I think my listeners and I have kind of heard about this.
yeah, so there's multiple of them out there. So Rubicon MD is one of them. There's also one called Thea Health. That's the one that we use. And it's basically a collection of different specialists that get paid per, I guess they get paid per referral or consult is my guess. And some of them are trying to do it locally, right? So like Thea Health, because we're in Austin, they do try to connect us with people who are local so that in case we did need to actually send them to rheumatology, it's actually the same person. Rubicon is more of a national chain, but we find it incredibly helpful, especially as primary care providers, because we don't know everything about everything, right? But one big problem with our current system is primary care providers have just become referral mills. That's all they do is refer out. It's like, oh, your blood pressure is high, go see cardiology, where we used to treat that. However, in our system, primary care doesn't make money. right? The reimbursement on primary care is so terrible that big healthcare systems don't make money off of primary care. They use them for referrals. And so a lot of primary care providers are actually incentivized for referrals. Like they have a minimum number
Really?
of referrals they have to do every month to meet their quota, right? And to get their bonus. And that's because that's how the health system makes money, right? So this is why all the little private practices are being bought up by the larger healthcare systems is that then when you're in, like Austin has a big Baylor Scott and White, it's a big thing here. And so all the Baylor Scott and White providers refer to the Baylor Scott and White surgeons and specialists, and that's where they actually make money. And so it's a big problem,
Wow.
unfortunately.
Yeah, I mean, that's a massive problem because also it takes away from doing the actual medicine of primary care, right?
Right.
I mean, you train for this, you're in debt because of this.
Absolutely. Yeah.
How are you gonna how are you gonna actually do it? How are you gonna do the
Yeah.
things, as they say?
Yeah. It used to be a primary would put somebody on 3 blood pressure medications before they would refer them. And now it's like they even get remotely diagnosed and it's like, "Oh, go see cardiology." And this is also why specialists are so backed up is because instead of doing the test, right? Like especially endo, right? Like
Oh my
somebody gets an
gosh, yeah.
abnormal A1C, it's like immediately to endocrinology. And it's like, actually, we could talk about diet and repeat this in 3 months and see if we can control it. And then there's multiple medications that I, as a PCP, can write.
Mhm.
And it's
Well, I mean,
frustrating.
and the thing you're not even I think the thing that, we need to emphasize as well is that with your practice model, it's not reactive. Like, sure, you may find that they have high blood pressure, but in your business model, correct me if I'm wrong, but you pay a monthly fee so that you can see, like, if you want to come in and see you every month, that's
Absolutely.
fine. That's covered.
Right.
That's
Mhm.
part of the
Yeah,
deal. If you want to really be aggressive in pursuing the lifestyle modifications to stay away from medication management, you can because you're there walking with them through that journey,
absolutely.
right?
There's a big problem with our current system in that it's not a healthcare system, it's a sick care system. We wait for people to get sick before we do anything for them instead of talking about sleep and stress and nutrition and body movement. And the reason we don't talk about those is because that's not what pays the bills. Turns out writing prescriptions gets you to be able to code higher, which then increases your reimbursement. And it's a whole thing. It's broken on so many different levels that
Yeah.
we have to get out of that system. Otherwise, we're just going to keep getting sicker and sicker and sicker. Like our
Yeah.
country just keeps going the wrong way.
It's still going that way. We're
Oh yeah,
trying to fight it.
absolutely.
I hope my
Hmm.
listeners can hear that people are actually trying to fight it.
We are. Go tell
What do
your
you
friend about direct primary care. That's your job
Yeah.
today.
Yeah. Listener, tell your friend and then tell your other friend. Now,
Right.
so what about how's that transition been? Obviously, you run 3 clinics now. You obviously had to hire a bunch of versions of you
Yep.
and staff associated, to run the day to day.
Hmm.
How has that transition been to becoming, the business owner now rather than the practitioner as much?
Yeah. It's been a lot of learning because as much as I managed patients, managing people is a whole different world.
Totally.
I also just assumed that everyone was like me, right? Everyone's exactly like Monica. They're going to treat patients the same. They're going to do all the things. And so I've done a lot of business coaching and consulting through the last, especially year and a half, to learn how to manage emotions and feelings. I have 10 full time staff that work for me, all women, which is great, but also there can be a lot of feelings and a lot of fairness. And so the thing that I do that I think really makes a difference is I treat my employees as I would want to be treated. Right. We've all had that toxic CEO, that guy who just doesn't care. And I'm not going to be that person. And so I really do strive to treat my providers as best I can. I do one-to-one meetings with all of my staff once a month. And it's not a time for me to tell them what they're doing wrong or tell them what they need to fix. It's a time for them to tell me what they need from me. And so really learning to communicate with people and learning that leadership style has been a struggle. But,
Yeah.
we're doing it. We're making it
Yeah.
for sure.
I mean, that's part of being a business owner is just learning how to manage people. It's just everybody does it a little bit differently, right? And you find
Hmm.
what your flow is as you go
Yeah.
through it. What
Yep.
what do you see as the more difficult aspects of the actual ins and outs of CEO life? Marketing, website development,
Yeah,
all
I
these
would
different things.
Yeah, the biggest struggle I have is determining what I need to focus on that's really going to move the needle in the right direction, right? I can be really busy, but being busy does not mean you're being productive. Those are two
Yeah,
very
true.
different things. And so making sure that I'm focusing my time and energy on the things that make a difference and also things that aren't necessarily below my pay grade, right? As a
Give
business
an
owner, it was
example.
really hard for me to delegate things because
Oh, okay.
I've worn every hat. I wore every hat. I did this solo for 15 months. I was the janitor. I was the marketer. The only thing I hired was a CPA because the IRS scares the crap out of me, right? And so I've done all the jobs and understanding that other people can do those jobs actually better than I can and finding those people was it was hard for me to do that. Just because I am an overachiever and I'm like, "Oh no, I'm the best at this, so I'm going to do it." But then I realized like writing emails and doing mundane things is not where I shine. That's not my thing. I am a relationship person. I am I'm a presenter. I'm a go out and talk to the people sort of person, not the behind the scenes like let's write a website. Also, I found that when I write my website, I write it in provider terms. And that's
Yeah.
not what your customers need to read, right? I can talk till I'm blue in the face about how our system is really broken from a coding and a reimbursement standpoint. That's not what people care about. People care about the fact that they can get in the same day. They get to
Yep.
see the same person all the time.
Yep.
They get a real relationship. They get price transparency. That's what people
Yeah.
want to hear. That's what
Yep.
sells what we do.
Yep.
And
That's what
so,
gets people coming in the door.
right, because what's not getting my clients in the door is Blue Cross Blue Shield, right? And I think that's one of the biggest struggles with direct primary care is my patients walk in the front door because they chose to. It is 100% free market, right? It's not because Aetna said, "Oh yeah, they're on your plan, so go see them." And so you have
Hmm.
to find your own patients. You have to convince them that you know what you're doing and you have to keep them. And so it can be a struggle, but it's also the most rewarding thing I've ever done. So there's
That's
that.
so cool. That's so
Yeah.
cool. I love that you've been able to kind of learn from that experience to say you could have worn every hat for 6 years, right? You could
Yeah.
have said, and then you'd be right back where you were, just burned out, crispy,
100%.
you know,
Yes.
staff turnover because you have no time for them, blah, blah, blah,
Right.
blah, blah. It all kind of
Yeah.
filters down.
Yeah. Learning to delegate has been one of the best things I've ever done. And I actually have two virtual assistants that work for me.
Uh-huh.
They're amazing, like
And
the
what
best
did
thing
you
ever.
delegate to them?
If it can be done on a computer, it's delegated to them, right? So
Sure.
I have a full time VA who is 100% works 40 hours a week for us and does all the behind the scenes stuff. If I need a spreadsheet, if somebody sends me something that needs filled out, I'm like, here, fill this out. And he's
Yep.
amazing.
Yep.
I can't even tell you all the things I have delegated to this man. He has it all laid out. And we use Loom AI, which is a
Yeah. Yeah.
screen
Yeah.
recording, because it'll actually write the SOP for me, the standard
Wow.
operating procedure. So it's awesome. We record it once because that's the biggest problem with virtual assistants is how do you train them when you can't like sit next to them and talk to them?
Yep.
But when
Loom is
you
a
can
great tool.
Oh my goodness. And we actually use it for our patients as well. So instead of making a patient come in to do a lab review, we'll pull their labs up on the screen, our pictures down in the corner, and we go through it. We're like, okay, this is your blood count. This is what this number means. And you have your mouse so they can see what you're talking about. And it saves us so much time because typically patients will try to interrupt you when you're going through their lab work. You know what they're going to ask. So if they would just wait, I'll probably answer your question. But it takes a minute and a half to record a video for them. You send it to them. They can watch it on their time when it's convenient for them. They can watch it 5 times and then they can follow up if they need to. And Loom AI will also write you a synopsis of it. So it'll be like, okay, your vitamin D level's low. We need to do blah, blah, blah. Your TSH is a little off. So we want to recheck it in 6 weeks. And then you just copy and paste that in their chart and you're done. And it's amazing.
Yeah. Because,
And
I
patients
mean,
love it.
well, and you're also not, because you're not billing for insurance. I mean, how are your notes? Like, how are your providers doing their notes
They
then?
are nothing. Let me tell you, there is no review of systems. There is no falls risk. There is no social history. Like, of course, that's in their chart, but it's
Yeah.
not in every note,
Sure.
right? There's no reason to put their past medical history in every damn note.
Yep.
I don't know who made that up. Also,
Yep.
review of systems should all be in your subjective aspect,
A
right?
hundred
Like
percent.
Why
100%
are
agree.
you repeating that? If they
Yep.
have chest pain, it better be in your subjective part, right?
It
Like
better
in the
be.
written part. Why do I have to put that in a review of systems? We also don't have to do the like, you have to document 2 things about 9 systems to get it to a level 4. No, right? Like if my patient is here to talk about depression, I may never touch them, right? If I've checked
Totally.
their blood pressure last week and it was fine, I don't necessarily have to check it today. Can I? Sure. But also, like, it's just not necessary. And so
You're here
our
for this. Let's
charting,
talk about this.
right? We also don't do ICD or CPT codes. And so we actually just type in the diagnosis like patient is sad because their dog died. Like you don't need to give someone a diagnosis of depression or PTSD because their dog died. Like they're sad because their dog died. Like that is my diagnosis.
Yep.
Thank you. And
Yep.
the good news is nobody can tell me I'm wrong.
Yeah.
And so
That's
our charts
that's great.
take 10% of our life. Like it's so much more simple. Like
So your providers are
we
living in an ideal world.
oh, they're living their best lives, my friend.
Yeah.
They work 4 days a week. They
Yep.
have an amazing life work balance. They take call once every 7 weeks. And no one calls us because they know that they can get in touch with
Yep.
us, right? They can
Yep.
send us a text message. We'll get it the next day. But we also had to set very clear boundaries so that people don't take advantage of that. And I think that's a big concern for people in the direct care space is like, well, it's unlimited access. Aren't people going to use and abuse me? No, not because you set boundaries with them, which I'm speaking very much from experience. I had to learn this the hard way, where
Because you bent over backwards. Yep.
if you let people walk all over you, you're going to be right back where you were in that burnt out insurance-based system. You have to lay very clear boundaries. And guess what? People will abide by them. They
Yeah.
understand, they respect you, right?
Yeah.
And so it is, they're all living their best lives. But yeah, our charting is just so that we know what we did, we know how to follow up, and we don't get sued. That's the
Yeah.
only reason we chart.
Yeah. And hopefully, I mean, from what it sounds like, and correct me if I'm wrong, but your providers are walking in to see a patient and they don't have the laptop there with them staring at the screen typing. They're actually listening to the person, looking them in the eyes, seeing what their facial features are exhibiting, if they're sad or if they're, happy, or they can actually ask about, why are you sad? Oh, your dog died. What was your dog's name? They can
Right.
actually ask those details,
Show me
not
some
because they
pictures.
need it for any, blood test or anything like that. They can just ask it because they're human.
Right. Because they care. Yeah.
Yeah.
And we also don't have medical assistants or nurses at our office. So
That's
when our
unique.
patients check in, they check in on an iPad and it sends our providers a text that says, hey, your patient is here. And the provider gets the patient themselves. So they aren't telling the receptionist why they're there. They're not telling the medical assistant why they're there. They're just telling the person that it really matters to. And so you aren't having to tell your story multiple times. We typically know our patients very well because we have so few of them. And all of our appointments are 30 to 60 minutes instead of 3. So,
Yeah.
yeah.
Where the 20-minute window is actually a 3-minute visit and then you're out the door.
Right.
Yeah.
Mhm.
Yeah.
Yes, absolutely.
So actually that's a good point. I mean, how did you work a model? Did you learn about the model where there's no MAs or no nurses?
So, a lot of DPCs do it differently. So,
Sure. Yeah. Give me that insight.
especially physicians, most physicians hire a medical assistant. And that
Okay.
is oftentimes because they've never really done a lot of vital signs. They've never done that part, right?
Mm,
And not that this is all of them, but they feel it's under their pay grade. Where all of my providers are nurse practitioners. So they were nurses first. So they draw blood. They
they've got the
do vital
skills.
signs. They do all of these things and they want to do them, right? I would much rather know that my blood pressure is accurate, right? So we do all manual blood pressures. We don't have
Wow.
machines, right?
Yeah.
It's like, no, I want to make sure this is real. So I will say most practices do have some sort of other medical person. We do not. We do have 2 administrative staff that are like real live here. One is my operations manager, and then we have a practice administrator. She does a lot of the phone answering. But when it comes to the actual medical care, our goal is to get rid of boundaries, right? And so the worst thing as a patient is you call into an office and you get a receptionist, and then she tells the medical assistant what's going on. Then she tells the nurse what's going on. Then she tells the provider, right? Why not just take it directly to the provider? And so our providers respond to all their own messages because it's who should, right?
Right.
Now there's some times where if somebody says, hey, I need to schedule an appointment, then the administrative people will take care of that. But if it's healthcare related, I want the provider to do it. And that's what we sell. That's the service we sell.
Mm-hmm. And so now that you see it's 2025, you're coming up on it's Q4. What do you have dreams for in this next 6 to 12 months for your practice? Do you have more openings in your clinics that you'd like to do? What
Yeah.
things are kind of holding you back from growth? I will say.
Right.
Big
Well, our
questions.
biggest issue to growth is education, right? People
Okay.
don't know what we do. Nobody
Sure.
is typing into Google direct primary care. So that is forever our struggle until I meet my ultimate goal, which is every person in this country knows what DPC is and it is the norm, not the exception, right? In 10 years, that's what I want to do.
There you go.
There was a time where I was going to open a new clinic every year. That was
Hmm.
my goal. I was going to get to 10 clinics and I was going to take over the world and change healthcare forever. Well, what I realized is every clinic is more of me. And I did not open this clinic to lose my time. I opened
Sure.
this clinic to regain my time.
Sure.
And so I actually went on a entrepreneur competition about a year ago called The Blocks. It's a reality TV show.
Cool.
I competed against 120 other entrepreneurs and I actually won. Spoiler alert. I won $10,000. You can go watch it. Go to my YouTube channel. There's a little synopsis, but
So cool.
it was after that that I was like, okay, I have to do all the things now because now I have validation that I'm actually a real business owner. And I quickly burnt the crap out of myself to the point that I was physically ill. And I was like, man, I can't do this. And so I admitted out loud that I didn't want to open any more practices. So for now, we're just going to fill the practices we have. They grow with marketing, right? Word of mouth, all the things. Based off of our current trajectory, we should be full of patients in probably like late 2029, right? So we're about at half capacity of our 3 clinics currently.
Gotcha.
So I'm waiting for the day when you can only join my practice if somebody dies, right? That's my dream. But um in I
I love that.
had to figure out how I was still going to take over the world, right?
Sure.
And so
Sure.
what I realized is that I can't open 10 more clinics, but I can find other amazing healthcare providers that want to be DPC providers and help them do it. So I wrote a book, came out about 2 months ago. It's called DPC Dream Job or Total Disaster. It's written for healthcare providers who are burnt out and want to know, is DPC the space for me? It's not a how-to book. It's a should you. Are you the right person? Can you be an entrepreneur? Can you get in front of a camera? What does life look like as a solo DPC provider? And then for those that get to the end of the book and they're like, this is amazing. This is what I want to do. I
Yeah.
created an online course that's
There you
called the
go.
DPC Launch Kit. And it is
Okay.
an 8-module course that goes from idea to launch so that you don't have to do all the research of how to establish an LLC,
Sure.
how to get a bank account, what the
Yep.
heck is an operating agreement. In fact,
Yep.
it's in the kit. It's written there for you. Just put your name in it. It's fine.
Easy.
Because I need more amazing healthcare providers to open DPC practices so that we can, in fact, fix the healthcare part of this world. And then I offer consulting because I love to teach people what I've learned. So
Yeah.
there
Well,
you go.
there's only one of you. And so instead of you trying to take over the world, you're empowering, I would say empowering other clinicians to help you in your mission.
Absolutely. And people have been like, why don't you just franchise it? And I'm like, because I don't want to be responsible for someone else's success, right?
Mm,
I know what it takes to do this, and it's not easy. I'm not here to tell you that it is. If it's your passion, it's going to be easy. But I'm not here to play that game. So I'll walk you
no.
through it, but I'm not going to be responsible for it.
Yeah. And there's another thing there I think that people need to hear, that you're not out to just like get greedy and make a buck off of
Yeah.
everybody. It's really, you want to empower people to help people. Like that's,
Yeah.
if we just hear that main message, right?
Right. I mean, my course is $300. So it's pretty affordable, right? And
Yeah.
I mean, literally goes from idea to launch pretty quickly.
That's so
So,
cool. And so
yeah,
you're
I'm just
basically,
here
I
to
mean,
help people.
and you're just documenting exactly what you did, right? And then
Absolutely, right?
cutting the corners on the things that you had to learn the hard lessons.
Yes, let me tell you how to not do this, right? Like, don't waste your time on A, B, and C. Focus on D, E, and F, right?
Yep. Yep.
So yeah, I hope to speak on more stages and go to more conferences and let the whole world know that DPC is the best place, not only for patients, but also for providers.
Totally. And I mean, it sounds like it. I've had a couple conversations with DPC providers and they preach the similar message. I just like your story just as much just because of how you started and how you've
Yeah.
progressed. And also, you recognize your limitations in the sense of, I don't need to take over 50 clinics. I got
No.
into this for this reason. Here's my why. Now I'm going to
Yeah.
trace that.
Well, and I also really had to redefine what success means because I think a lot of us chase what we think other people think success is, right? I never like wanted to open 10 clinics, but hey, it sounds cool, right? But what I realized is success is not a revenue number to me. It is not a
Mm,
patient number to me. It is spending time with my family, traveling, doing what I love, and knowing that at the end of the day, I've helped people and that my employees are happy and that they're living their best lives and that hopefully we can change healthcare. So, really like figuring out what does success mean to you, I think is really important.
I think that's a great clip for us to kind of end on. I think it just kind of ties together everything that we've kind of talked about in this episode of
Yeah,
success can be different for everybody, but are you helping
absolutely.
people and can you provide for your family? Then great. What else do you need?
Right. Feel like if your bills are paid, your spouse doesn't suck, your children are alive, well, that sounds pretty good to me.
They're alive. Make sure they stay that way.
Right? That's our key. That means good parenting, right?
Yeah. And so just for my listeners' sake, and obviously we'll post the link in our podcast, but where do they find you? Where do they find your materials?
Yeah.
What's the
Well,
best
I mean,
way?
Monica McKitterick is a pretty odd name. So if you just Google my name, you'll find all the things.
You're
But
usually
my
the first one.
clinics, yeah, right. I think I'm the only, right? My clinic is called Impact Family Wellness, and we are that on our website and all of the social options. My course content can be found at thedpcformula.com, and that's where you'll find links to my book and all the other things. But yeah, feel free to reach out to me in any of those platforms. I am here to help. Ask all the questions.
You're here to be available. We're really grateful for you joining us today. I think it was a great convo, and I'm really excited to see kind of what growth comes in the next few years.
Yeah, it's going to be great. I'm going to be on a beach somewhere. That's my goal.
Yeah. That's our next episode in 2020. We'll say 2027. We'll see. We'll tune back in
I mean, I do a lot of traveling now, so it's not a problem. But
sooner than
yeah,
that, then.
absolutely, for sure.
All right. Thanks, Monica. Thanks for your time today.
Thanks so much, Ben. I appreciate you.
Yeah. Bye.